In this video, I help you understand how your cost for physical therapy could be greatly different from one facility to the next and help you become more educated consumers of healthcare. Hey, it's Michael with Total Physical Therapy, and in today's video, I share with you a real-life conversation that I just had with an individual regarding the cost of her physical therapy. So let's set this scenario up because it is a phone call discussion that I deal with very frequently. It has the same underlying theme, and I want to help educate and inform people on how this scenario truly plays out. Now, in this phone call, this individual was already currently receiving physical therapy services from another local facility, and that facility was in network with her insurance. We were also in network with her insurance. Now, she had not met her deductible on her policy yet, so essentially 100% of the allowed charges she was having to pay out of pocket to help satisfy that deductible. Now, after going to a couple sessions, she was faced with a bill that was over $1,200. This means that in 2 sessions of physical therapy, she had been billed for services and her insurance had held her accountable, meaning they were allowed charges for over $600 per session. Now, when I verified her benefits and identified our contractual relationship with her insurance, I was happy to tell her that her out-of-pocket expenses would have been $130 per session. This was drastically different than that $600+ per session. Her inquisitive mind naturally took her to her next question. Why is there such a significant difference? Well, to answer this question, we have to compare apples to apples first. Number one, we have to identify and make sure that the same interventions, meaning the same procedures, are being done from one facility to the next. We also need to identify and make sure that the same length of time for each of those sessions is equal. And once we've identified that the type of interventions and the length of those interventions are the same, now we can bring up a final concept, and that concept is contract pricing. And in another video, I discussed this concept, contract pricing, in brevity, but I'll refresh those of you that have forgotten or didn't see that video. Contract pricing means that your facility, the providers within that facility, and the insurance company have agreed upon a rate. That rate is referred to as a fee schedule. And in just a moment, I'm going to give you a real-life example of a fee schedule and how you can see that that can drastically influence the total out-of-pocket expenses. Now, before we get into the example, let's first talk about a ruling that Medicare and Medicaid Services established a couple years back with a recent update this calendar year, January of 2021. Now, in this rule, CMS established the requirements for hospitals operating in the U.S. to establish, update, and make public a list of their standard charges for the items and services they provide. CMS felt like this level of price transparency, it can only improve market decisions and help drive the cost of healthcare to more affordable pricing for patients. Again, this was a ruling by CMS which forces hospital groups to provide this type of information in an easily digestible, understandable document. So further in this example, if we navigate to other areas on the website, we're going to find that the pricing tool, or rather the document that is supposed to reveal that information, can be found with this link here. Now, pulling up the actual document from that link reveals a list of codes and charges for a slew of different interventions, but we're going to draw your attention specifically for outpatient physical therapy for the purposes of this video. Now, in being able to decipher and determine some of your cost, we've got to first talk about what are in these columns. Now, in another video, I made mention the fact that interventions in healthcare are billed to insurance groups in numerical language. So this numerical lingo is considered a CPT code. And in this column D, you're going to find a list of all of those CPT codes. You conveniently have a description of those codes here in column E, but without the descriptions and without working knowledge of the CPT codes, and furthermore without a working knowledge of what would be billed to your insurance on any given date of services, I would argue that these columns over here would be a little misleading. So let's break this down a little bit deeper. Let's first look at an evaluation. Now, in another video I also mentioned the fact that this code 97162 is going to be a very commonly billed code for the first date of service with a physical therapist. If we continue on across this chart, what we're going to find in column F here, we're going to see a gross charge. This would be just the blanket charge that your insurance was billed from this hospital group. You'd also see a cash price. If you were uninsured, you would expect to pay a cash price of $238 for a physical therapy evaluation, and you're also going to see negotiated rates with specific insurance carriers listed out here for this code. Now keep in mind, this is just one procedure provided on the first session with the physical therapist, but there are likely to be other charges for that date. To take a look at some of these charges, let's navigate to this column here. A very commonly used charge in the physical therapy setting is the CPT code 97110. This is a code that is billed out for therapeutic exercise. If you received an intervention that fit that definition, it's likely that a therapy facility would bill you for this code 97110. Again, we can take this column and we can identify the charges, the cash price, the negotiated rates with certain insurance carriers with this hospital group. Now, what is a little bit different between codes like 97110 and the evaluation code that we took a look at just a moment ago is the fact that this code here, 97110, is billed out in increments of time. So whereas a physical therapy evaluation that we saw in the column here, this would be one flat fee. For example, if you are paying cash for a physical therapy evaluation, you would be asked at this facility to pay $238 for that, in addition to any other cost associated with other interventions. Now, it would be reasonable and very likely that in a session of physical therapy, you might be faced with more than one code of 97110. If you were billed at 2 or 3 or 4 or more units of this code, this would not simply be $135. This would be 135 times the number of units that were actually billed out. So in the original description of this video, we talked about a $600 therapy bill for a date of service, and when we look at these price reflections here, it's easy to see that if a $135 charge is charged 3 or 4 or more times according to the amount of time that was spent with you, we can very quickly get to a $600 bill. Okay, I've given you a real-life example of how these numbers can differ tremendously from one facility to the next. We've identified the fact that that $600 physical therapy bill could have been fractions of that at another facility. But I want to reiterate that you should not choose your healthcare facilities based on price alone. I encourage you to ask questions, be better consumers of healthcare, more informed and educated consumers of healthcare. Identify the needs that you have, seek out the solutions that those providers have for you, and then start asking about your associated cost with their ability to deliver that care. If you enjoyed this video, please comment down below. Let us know other topics that you're interested in or other details of these situations that you'd like to know more of. Thanks everybody for joining. We'll speak to you next time.